Over-the-counter painkillers like acetaminophen and ibuprofen might be silently worsening one of the biggest health threats of our time, antibiotic resistance. But here's where it gets controversial. These everyday medicines, which most people assume are harmless when used appropriately, could actually be making bacteria tougher against antibiotics in ways many don't realize. Antimicrobial resistance, AMR, is the process where bacteria, viruses, fungi, and parasites evolve to survive drugs meant to eliminate them. This leads to infections that become harder and sometimes impossible to treat, posing a critical global health challenge. According to a groundbreaking study, not only do common painkillers contribute to AMR when taken alone, but they significantly amplify this effect when combined with antibiotics. Researchers from the University of South Australia explored how widely used non-antibiotic drugs interact with ciprofloxacin, a broad-spectrum antibiotic often prescribed for urinary tract, skin, and gut infections, and Escherichia coli, E. coli, a common bacterium known for causing infections in the gut and urinary tract. Their findings were alarming. Acetaminophen and ibuprofen dramatically increased the rate of bacterial mutations, making E. coli far more resistant to ciprofloxacin. This discovery is particularly troubling for vulnerable groups, such as elderly residents in aged care facilities, who frequently take multiple medications for chronic illnesses. The study's authors caution that these combined drug effects could exacerbate the risk of untreatable infections in such populations. AMR has been declared by the World Health Organization as one of the top threats to public health and development worldwide. In 2019 alone, bacterial antimicrobial resistance was linked to nearly 5 million deaths globally, with over 1.2 million directly attributed to resistant infections. Professor Riti Venter, a microbiologist and co-author of the study, explained to Newsweek, AMR happens when microorganisms adapt to survive treatments designed to kill them. This means the drugs lose their effectiveness and infections become harder to control. As a result, the chances of spreading disease, severe illness, disability, and death rise dramatically. Traditionally, the main driver of AMR is the overuse and misuse of antibiotics. But Venter points out a surprising addition. Our research indicates that even non-antibiotic medications are contributing to this problem. When bacteria are exposed to ciprofloxacin along with ibuprofen or paracetamol, another name for acetaminophen, they mutate more rapidly. This helps them grow faster and become resistant, not just to ciprofloxacin, but to several other types of antibiotics as well. The team investigated 9 medicines commonly administered in aged care settings, including anti-inflammatory drugs like ibuprofen and diclofenac, pain relievers such as acetaminophen and tramadol, blood pressure medication like furosemide, diabetes treatment metformin, cholesterol-lowering atorvastatin, sleeping aid temazepam, and the decongestant pseudoephedrine. Interestingly, the bacteria were exposed only once to these drug combinations during the study. But even that single exposure increased the mutation rate by as much as 12 times. When multiple drugs were present together, each bacterium carried more mutations, resulting in higher levels of antibiotic resistance. Venter emphasized, some painkillers, ibuprofen for example, may promote antimicrobial resistance on their own, but when combined with antibiotics, the effect intensifies significantly. If these painkillers are still present in the gut at the same time antibiotics are taken, it can create the same problem as taking them simultaneously. The researchers urge further studies on how long-term use of multiple medications affects antibiotic effectiveness, especially in patients managing chronic conditions with complex drug regimens. However, the findings are not without some debate. Professor Tim Walsh, a leading microbiologist from the Ineos Oxford Institute in the UK, noted that while non-antibiotic drugs influencing AMR has been recognized since the early 2000s, this new study's scope was limited to laboratory conditions using only 2 strains of E. coli. He pointed out that without testing in living organisms, such as gut models in animals, it's hard to know exactly how these results apply to real-world infections. Walsh also stressed that people should not panic or stop using painkillers, as they remain safe and effective when used correctly. He reiterated that antibiotics should only be taken when prescribed by a healthcare professional, and strictly for bacterial infections. Venter added that their research is the first to systematically examine a range of medications frequently used in aged care alongside antibiotics, studying their combined effects on clinically relevant gut bacteria at realistic gut drug concentrations. Taking painkillers alone isn't the main concern. The problem arises when multiple medications interact with antibiotics, she explained. This raises provocative questions. Should we reconsider how we coordinate medication schedules, especially for elderly patients? Could our reliance on over-the-counter painkillers be quietly undermining antibiotics' power against infections? And if so, how urgent is the need to rethink everyday drug use before AMR spirals further out of control? Are you surprised that common painkillers could be helping bacteria fight antibiotics? Do you think this should lead to stricter guidelines for over-the-counter medication use?
Share your thoughts and join the conversation below, because the future of effective infection treatment might depend on unraveling these hidden drug interactions.